Morning sickness is one of these where I'm like, it is so misnamed
Yeah.
because it is not morning sickness. It is literally all day sickness. I really, really envy those who don't experience any of that. And I found myself wanting to go back in time and talk to all of the pregnant mamas that I had spoken to previously prior to being pregnant myself to discount like all of the advice that I had given. Cause I'm like, ginger, acupressure, acupuncture, all of these things, really wonderful tools for what I lovingly call the itty bitty shitty morning sickness. But when you've got the real doozy stuff, I'm like, medication is just like absolutely sometimes needed.
Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast.
Hello, and welcome back to the Advanced Women's Health Podcast. I am Dr. Michelle Messer. I'm located at the Sudbury Advanced Women's Health location, and today I'm joined with the wonderful Dr. Heather. Care to tell us a little bit about yourself, Dr. Heather?
Yes, I'm Dr. Heather Elford. I'm a naturopathic doctor in our Brooklyn Advanced Women's Health location. And I see a lot of patients, obviously, a lot of women for reproductive concerns, but I'm also a doula. So I love seeing patients for pregnancy, preconception, postpartum, and I also love seeing all the kiddos. So that's kind of my little focus that I see patients in.
Amazing. I actually didn't know you were doula trained. I too am doula trained. Granted, don't practice it at all, just integrate that information into clinical practice.
Yeah.
For those of you who are joining us, today we're going to be talking about all things after hours pregnancy related, all of the symptoms that people don't necessarily know are associated with pregnancy. There's a lot that kind of goes into that. And we just wanted to shed some light on some of the secret kind of symptoms that people oftentimes experience, sometimes what causes them, what we can do about it, and really just normalizing kind of the pregnancy experience. Given a surprise for any patients who may not know this yet, Dr. Heather and I are both expecting at present. How far along are you right now, Dr. Heather?
I'm 23 weeks.
Okay. Oh man, we are close together. I'm 24. So I'm we're just a hop and a skip away from each other. But as we've talked about previously, our experiences have differed pretty significantly. We can hop right into it. Walk us through how first and second trimester have been treating you.
Yeah, I mean, I'm very happy to be in second trimester. It's a lot nicer. I mean, that's not always everybody's experience, but yeah, I had a lot of naps in the first trimester, a lot of nausea in the first trimester, lots of weird cravings that have kind of like carried on a little bit in the second trimester, but like finally feeling like I have better energy, feeling a little bit more like myself in the second trimester. So that's been nice.
Yeah, it's so true. I'm like that. The morning sickness is one of these where I'm like, it is so misnamed because it is not morning sickness. It is literally all day sickness. I really, really envy those who don't experience any of that. With my first, was able to power through and get away without medication. And with this pregnancy, that was absolutely not an option with chasing after a toddler. And I found myself wanting to go back in time and talk to all of the pregnant mamas that I had spoken to previously prior to being pregnant myself to discount like all of the advice that I had given. Cause I'm like, ginger, acupressure, acupuncture, all of these things, really wonderful tools for what I lovingly call the itty bitty shitty morning sickness. But when you've got the real doozy stuff, I'm like, medication is just like absolutely sometimes needed. And I actually kind of want to talk about that for a second, because especially in our realm, like in the natural health sphere, there's a lot of aversion to add, like to utilizing medication. And I think that there's something to be said about really leaning into the supports that you need, especially during this time. I found one personally, it's made a huge difference as far as mental health goes around two. But two, like not being able to function when you're so sick really limits your ability to like access movement, to be able to make different food choices, right? That there's like other health parameters and considerations you're actually able to like meet because you're not, I don't know, a potato on the couch who's slowly dying, right? So it's something to be said that if anybody is listening to this, or just make a mental tidbit for if and when you do become pregnant and do experience any of that, that it's like incredibly okay to access medication. I was also incredibly surprised at how much I had to advocate for it. That a number of my providers were just like, nope, like just take B5. I was like, but I am, and it's not working. And the other beautiful thing that isn't diclectin is an antihistamine. And for all of those who have listened to the histamine podcast that we've previously recorded, nausea can very much be a result of histamine. And so making sure that you're getting whatever supports you need so that you can function is really key. What's your relationship been like with medication this go around?
Yeah, I actually was the same. I feel like obviously being NDs, we're like trying to do all of the things as natural as possible. And I went in being like, I want the lectin, like I want to do ginger, I want to do acupuncture, all that stuff. And then I got to, I think it was 6 weeks, and I couldn't even keep anything down. I think I woke up my husband in the morning with like my bucket beside the bed. And I'm like, maybe this is not great. Like, I can't even work if I'm like this nauseous all the time. And I'm at the point where I'm like, I can't even keep down water. So it's like, okay, it's that whole like risk benefit ratio. And at that point of like, okay, I need to actually keep some food down for myself and for my baby, keep down fluids. And if medication is going to be the way to do it, by all means, like, let's do that. So it was a game changer for me. And I was like, you know what? I feel like my team is a little bit different, even the patients too, which is good.
Yeah, it's different when you've kind of walked the walk with some of these things to be able to relate to some of them. Some of the other tips that I have for anybody who's listening who might be struggling with any kind of pregnancy associated nausea, obviously the medication that we discussed, again, like ginger, be it candied ginger, ginger capsules, teas, what had cooking with ginger can be helpful. And there's some research to show that that can be useful. There's also a pretty handy, again, for the mild stuff, a handy acupuncture point called PC6. It's easily Googleable. But essentially, the motion sickness bands that they sell at like most pharmacies and online, they're meant to stimulate that specific point that can help to reduce some motion sickness and some nausea. Again, when you're still kind of nauseous, can be a helpful tool if you're doing some deep breathing at the same time. But I found one of the biggest pieces of that puzzle in terms of avoiding or minimizing the amount of nausea that you experience is making sure that your stomach's never empty. We talk a lot about insulin resistance on this podcast and how frequent snacking isn't necessarily in alignment with that. But the two big exceptions, and there are others, in terms of snacking being critically important is for pregnant women and toddlers and making sure that both are fed kind of constantly. It does make a really big difference. Even just keeping like a snack on the nightstand goes a really long way. So something to consider. Did we have any other fun pregnancy symptoms that you were surprised by in your first trimester or even in your second?
I mean, lately in the last few weeks, like second trimester, and I was saying this to you before, but the insomnia I've been having is so weird. I was even saying the other day, I'm like, maybe I would go back to the nausea if I could like give up this insomnia. So I'm like, oh, maybe it's just preparing me for this newborn stage. But yeah, that like I didn't really like expect that. Like at least like this far along, because I'm not like super huge. I'm not super uncomfortable as far as sleeping, but I'm like, I just can't sleep. I just keep waking up and that's it. I'm done.
Well, and again, like this is where that hormonal component comes into play, right? That like the hormonal shifts that happen can definitely contribute to insomnia. On top of, again, we talk about this often, but like we're in a really high estrogen state right now. And with that really high estrogen state comes an increase in histamine. And we know that histamine, for those who may be unfamiliar, is essentially a chemical messenger that plays a role in like allergic reactions. So thank you, congestion. Thank you, itchy eyes, which also happen in pregnancy. But also it plays a really big role in your sleep-wake cycle, stomach acid production. Again, thank you, reflux. Thank you, insomnia. So like it can show up in a number of those places, but it's why when somebody takes an antihistamine, it says it can cause drowsiness or keep you up, right? And so it can really show up in a number of ways. But the insomnia can very much also be real. Have you found any kind of strategies or coping tools that have been helpful in terms of getting back to sleep or managing that, so to speak?
I've definitely been trying a bunch of different things. I am trying to make sure that I'm moving a little bit more in the day so that I'm actually more sleepy at night. Part of it is like, obviously, we're recording during the holidays, so all of the routine is thrown off, and maybe my body's just like, we're just done here. But also making sure like blood sugar levels are stable through the night. So getting a good spoon of nut butter. That's what I've been doing before I go to bed. I'm like, okay, let's just try to make sure that I'm not like waking up because of blood sugar issues. And then also like a few nice little herbs that I will take that are pregnancy safe whenever I am starting to like wake up in the middle of the night. So that's been helpful. I'm like starting to get a little bit better.
Yeah. There's some of us that I feel like there is a certain degree of struggle, not to fearmonger for anyone. That was also a disclaimer that I meant to start off this with, is that like this podcast is not meant to make anyone fearful of becoming pregnant, but it's also just to go in a little bit like eyes wide open, or especially I feel like the first time around, you're like, is this normal? Like I haven't a clue what to expect. And it's easy to kind of spiral, especially if there's any degree of kind of like pre-existing anxiety, but really just to normalize kind of some of those symptoms. But yeah, the insomnia again can very much be real. One of the perks of the diplectin is that it has made me particularly drowsy, which has been like a lovely perk and therefore sleeping better. I have found everything that you said. Again, making sure that your blood sugar is regulated. For anybody who's listening, again, like if your blood sugar gets too low, and lows will come either from not having eaten enough or well during the day, or they can come from going high and then crashing. But in those situations, your body has to produce a stress response to help to bring that blood sugar back up. And in that process, it can wake you up. So a lot of people who are struggling with insomnia, pregnancy and unpregnant, like not pregnant related, that actually can be a blood sugar regulation issue. And so I'm really glad that you brought that up because it's the relevant piece of the puzzle. Speaking to other histamine symptoms that are related to pregnancy, the congestion, I'm like, is that something that you've been experiencing? And when did that kind of start for you? So
Not a ton, actually. That's
Oh,
not been like a big thing for me, but has that been for
beautiful.
you?
Oh gosh, I'm like, as I sit here with my box of Kleenex, I'm like, I'm like, I'm never far from any of that at this point in time. I feel like I'm constantly having to explain to people that I'm like, I promise you I'm not sick. I feel allergic. Like this is entirely fetus driven and histamine driven. It's funny because you end up treating a lot of what it is that you personally struggle with, and histamine issues are something that clinically I speak to often and that I currently and historically have experienced. And so, yeah, the congestion is real. The dry eyes were real, I want to say, in the first trimester as well. Really, I find the things that make a big difference from that respect. Truthfully, I not very naturopathic of me, but the truth, I'm like, I live with Vicks under my nose for my entire pregnancy. I'm like, I don't touch that bottle any other day of my life. And then when I'm pregnant, it is like a must have. Cold, wet socks can be helpful just in terms of like giving you some relief of congestion. So for those who are unfamiliar, it's a hydrotherapy. It's hippity doo dah. It does not sound scientific at all, but I'm telling you it works. Is that you need two crucial components. You need to go to bed with warm feet, and you need a pair of 100% wool socks. And essentially, when you're getting ready for bed, you take a pair of regular socks. You get them as cold and wet as you can, well, with the cold tap water. You wring those out. You walk over to your bed. You put on your cold, wet socks on your dry feet, and then you cover them with dry wool socks and you go to bed. When you wake up in the morning, magically, they will be dry and warm and cozy, and you will be able to breathe through your nose. So that is a really helpful tool, whether you're sick or just congested from pregnancy. But honestly, with the congestion piece, there are some antihistamine things that we can do in pregnancy that can be helpful. But to some degree, again, between the increase in circulation that's happening from like blood volume doubling, from the hormonal changes, from the histamine changes, congestion is just gonna be part and parcel for some. But that's a big one. Speaking of other histamine symptoms, reflux been a thing for you or not so much this time?
Not so much. Definitely the dry eyes, though, when you brought that up. I was like, is everything fine? Am I okay?
But that's what I mean, though, is like all the time you're like, is this related? Like, could
Yeah.
it possibly be? And like the answer is almost always yes. And it's a
Yeah.
hard line to toe because, again, this isn't meant to normalize. If you feel like something is truthfully wrong, always bring it up with your care provider. This is not meant to sweep everybody's symptoms kind of under the rug because you can have other things that go on in pregnancy that are not pregnancy related. And truthfully, sometimes you need to advocate for those because sometimes, even like postpartum, there's a lot of just like mom is a diagnosis. And I'm like, motherhood is not a diagnosis. Being a mom is not a diagnosis. That like if you're tired, we still want to investigate why that is. And same goes for in pregnancy. But this is again just to speak to the fact that there's a fair amount of this that is in fact normal and part and parcel. But yeah, the dry eyes can be one. Again, that reflux can be another and can change so much from one pregnancy to the other. With my first, I found that there was really only one or two episodes where I was like, I think I might be dying. Then this is like in the middle of the night, I'm like, oh my gosh, is I have a whole new level of empathy for my patients who struggle with reflux. But I'm like, this is god awful. And my partner went running up to get some Tums to save us because like nothing else was cutting it. Granted, calcium can actually make a really big difference. Like a CalMag liquid can go a really long way for those who struggle with reflux. Managing constipation can make a really big difference because if you have a tube that is blocked, then, pressure has to go somewhere, right? And so up can be one of those ways. Speaking of which, any tips or tricks that you have for constipation, because that is one that comes up all too often.
Yeah, I mean, you and I were even mentioning this a little bit together too, but like making sure you're on top of fluids, making sure that you're actually having like good amounts of fiber, that's super helpful. And then magnesium as well, like have been really helpful. But it's still like I was saying, like I never had issues pre-pregnancy with bowel movements or anything like that. And now I'm like, I can't wait to get this baby out and do a clear out and just feel like everything is flowing a bit better. Because it's crazy. Like I was not expecting that to be like such a big thing.
Yeah. Well, and it can really kick in early. So like it can kick in like long before there are like anatomical reasons why that's happening. But progesterone, which is a hormone that you get post ovulation and helps to maintain the pregnancy once the placenta is formed, it takes over progesterone production and progestation. It's meant to maintain a pregnancy. And progesterone, one of the many things that it'll do is it will slow, smooth muscle contraction. So your uterus being a smooth muscle, we're not trying to eject baby until, the third trimester, but other smooth muscle can also slow down, which is where we can start to see, again, the constipation kick in well before you have anything compressing bowels. Granted, that can get worse kind of as baby grows and bowels are smushed and not moving quite as well as they once were. So that can very much make a big difference when it comes to the constipation piece, or at least explain why it is that it's happening. I would say that the other parts that go a really long way are movement, like making sure that you're getting adequate movement. And I want to say that's something that isn't always necessarily discussed sufficiently in pregnancy, is the importance of movement for like all of the reasons, but that birth and labor is really like lovingly a marathon for most. And it requires a fair amount of energy expenditure. And so you want to make sure that you're kind of like trained for that, right? Like we wouldn't go into a marathon, done a couple laps at other points in time, not having trained, right? And the same goes for pregnancies, that we want to make sure that people are taking care of their core, that the glutes are really strong. All of those things can make the labor process itself a little bit easier and smoother, but really, and I can speak to this personally, make a really big difference in the postpartum experience. I think this is another place where I advocate for medication if you're really, really struggling, because I basically rotted in my first pregnancy. I worked and then I did nothing because I was just so ill. And that was all I could kind of muster at that point in time. And I had a fair amount of muscle atrophy in that period. And it led to a lot of postpartum, like back issues and like sciatic issues and things of that nature. This pregnancy, one, I have a toddler to chase after, so there's not nearly as much option to veg. But two, like consciously making a choice to make sure that I'm keeping those muscles strong so that that experience can look a little bit different. On top of the fact that like it controls blood sugar, it reduces your risk of dying from literally everything, which like very few tools do. Helps with bone mineral density, mental health. Like there's just not a place where like moving your body isn't helpful. And do you have any tips on like how to get people moving when they're like, ugh, I hate the gym, I don't like picking things up? Like how do you kind of help coach people into finding something that they enjoy doing?
Yeah, I feel like one of the biggest things in pregnancy is that people feel a bit scared to move. Like they're just kind of like, there's this mentality of like, oh, you're pregnant, you shouldn't be picking up things, you shouldn't be like moving or doing things, like you need to rest. And that's like the opposite of what actually is beneficial. Like even in the first trimester for me, I have a dog, so I have to move every day and take him for walks. So that was like helpful, even like from a nausea perspective. Like often if I was just like lying on the couch for the whole day, I would feel worse nausea than if I were to actually go out and do some movement. So get a dog, that's one option.
Science,
Maybe
especially if
not
you have
in pregnancy.
yeah, especially with the allergies if you had them to dogs. Just give
Yeah.
her. That's the right
Exactly.
time.
Great medical advice. But yeah, I think doing even just a little bit of something that you feel is enjoyable. So for me, like I love doing yoga. It's something that I've always like done as part of my morning routine. And then obviously when you're in the first trimester, a downward dog is not really like a great idea when you're super nauseous. So that was like a little bit more challenging. But once you are starting to feel a little bit better, or on days where like you get a little bit of a breakthrough in your nausea, like you're feeling better, like being able to move in some way can be helpful just to start that routine. And then there's lots of places like locally for me, there's a place that does prenatal yoga classes. So every Friday night I would go and I would do like prenatal yoga with some of the other moms in the community. And that was super fun just to keep me motivated so that I'm like, okay, this is on my schedule. This is something for me to do. So that's always like a good option as well. Like seeing if there's any classes in your area that will actually like help keep you motivated. And then, yeah, do like a little bit of something that you love. So it's like for you, I mean, like my healthcare providers too have been saying, like, if you're not a marathon runner, don't start taking up marathon running in pregnancy, obviously, but do something that feels like it's enjoyable, that you were doing pre-pregnancy, that you can still maintain and do that. And you don't need to be afraid that you're going to like hurt your baby, hurt your core, hurt anything like when you're doing those things. Obviously, there's some things you have to be mindful of, but in general, moving is going to be better than not.
Yeah. I think it's really important to listen to your body in terms of those things, then making sure that you're like taking breaks, but like moving exactly as you said. And I think the threshold for that, it's so interesting because like there's so much fear that goes into pregnancy in terms of like all the things that we can't do and we can't eat and we can't experience. And sometimes we just need to apply some like rational thought to those. Like, should we doing, P90X, like the Abraberex? Probably not in your third trimester. Like, that's probably not doing your core any favors. That being said, pelvic floor physio can be like a really great guidepost. So if you're ever, unclear on what's too much, what's not enough, kind of like where the line is, pelvic floor physio is amazing. And so for, again, those who are unfamiliar, pelvic floor physio is essentially physiotherapy for your pelvic floor, which basically is all of the muscles that make up, kind of the bottom of your pelvis. And your core is made up of your abs, your back, your diaphragm, and then that pelvic floor. And if you have weakness in one side of your can, so to speak, you're more likely to experience like that can crush and crumble, right? And so making sure that that's in a good, strong place. And this goes well beyond Kegels, just so we're clear, because a lot of women hold a lot of tension in their pelvic floor, and we actually need to see that released and strengthened in order for people to have a strong, pelvic floor and to not have, urinary incontinence or pelvic pain or what have you. So if you're struggling from that perspective or you're having pain when you are exercising, just consider that pelvic floor physiotherapy is, I refer to them all the time. They're just such a key component of things. But yeah, I think that when you were talking about movement and the fear piece, that you're entirely right, that making sure that like you're still a person and moving your body is helpful and that we want to keep up that strength. And so sitting and doing, being a lump on a log isn't necessarily the solution to those things.
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada. But don't worry, if you're in another province, still reach out, get added to the wait list as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started.
In terms of some of the aches and pains, we've talked about around ligament pain. Is that something that you've been experiencing? And can you tell us a little bit about that?
Yeah, I mean, even the other day, I sneezed. I was like, whoa, that felt really weird. So, yeah, and it's kind of like obviously this is my first pregnancy, but just going through it, I'm like, is that fine? Is that normal? Like, should I be feeling that? But I also have a really wonderful chiropractor that I'm working with, and he will do like a lot of ground ligament adjustments and things like that. So that's been really helpful. But
Amazing.
yeah, it's a weird sensation if you've never felt it before.
No, it truly is. I'm like with my first, I don't think I experienced any. And with this one, it happened, oh my goodness, like almost right away. I want to say I was like 7 weeks pregnant and rolling over and be like, whoa, what was that? So like, and it was an unfamiliar feeling. For those who are in subsequent pregnancies, FYI, symptoms kick in like way sooner. And apparently this is common knowledge. It was not common knowledge to me. I was shook at how fast everything was happening, both in terms of like the bump showing up. I feel like that was evident quick, but also like the congestion and the around ligament pain like kicked in right away. Even like the morning sickness this time around, it was like I took my home pregnancy test and it was like the next day I was like, and we're sick. Okay, like it's happened. Like we're here now, which is like a real trip, but it's a funny one. Another thing that we had talked about kind of behind the scenes is the surprise around some of the changes to the body that happened early, specifically pertaining to like breast health, like in terms of the shifts that happened there. Can you speak to that relative to patients or yourself or whatever that might be?
Yeah, I mean, definitely in the first trimester, the first little while, like breast tenderness was whoa. Like very like I was like, this I must be pregnant. I've never felt like this kind of like symptom premenstrually for myself personally. So that was a big thing. And then definitely like my bump hasn't grown that much, but definitely my bra size has. So I'm like, okay, well, if there's any indication that I'm pregnant, it's that. So yeah, that's definitely been like a big change for sure.
Yeah, the breast tenderness is wild. And I, again, this time around, couldn't believe how long that lasted and how like severe it was. Finding yourself a good bra goes a really long way, not medical advice, just woman to woman advice. And it goes a really long way from that respect. For those who don't necessarily experience that change, because sometimes I hear patients who experience some anxiety relative to that, that they're like, I don't know if I'll be able to nurse. I don't know what this means. Like, does this mean I have glandular insufficiency? There are those who like have very little like breast tissue who go on to have like very, very successful nursing journeys. And there are those who are like heavily chested who struggle quite a bit. So like that two are not mutually exclusive, but that it does seem like the discomfort that goes along with breast tenderness does seem to improve throughout pregnancy. I haven't found a ton of people who struggle with it throughout the whole thing. So hopefully that comes to an end for you if you are experiencing this and listening. But that's a big one. Another one that came up for us was the good old fun baby brain and the impacts that happen there. It's funny because we've talked about this, but the choline is just one in terms of the experience with baby brain. It's intense, or it can be intense at times, but making sure that you're getting enough dietary fats goes a really long way, and choline being one of them. Eggs are really concentrated in choline, so making sure that you're getting enough of that from food, but also supplementing. And we talked about how when both of us skip or miss a dose, that it's like it's a palpable, noticeable thing. How has that been for you?
Yeah, it's only been in like the last like few weeks that I'd run out of my choline and I had to wait to get it shipped back in. That I'm like, oh yeah, I am forgetting things, or I am like having moments where my words are coming to me. So yeah, and that was definitely like a very noticeable thing. But and then obviously as naturopaths, like we need to have our brains sharp for our patients and for working. So anytime that happens, I'm like, oh dang, I need that choline back in, my poor patients.
Uh, I know it's happening for me when I have to like close my eyes to think of a word that it just, I'm like, it's right there. It's going to come to me. I'm like, all of the knowledge is still sitting there. She's just behind a curtain. I just have to wait for it to move. So I'm like, humor me for 2 seconds. We're going to get there. And we always do. But it is a funny experience. Another one of the symptoms that I do see a lot of patients come in with who have concerns, questions, very taboo, and so nobody's talking about them. So perfect for the After Hours podcast, but is vaginal discharge that I think anyways, the normal kind of experience when it comes to vaginal discharge is that, again, we're in a really high estrogen state. And with that, we're going to see an increase in secretions. And so going to see an increase in what's going on from that respect, which is entirely normal and to be expected. I also see, and I don't know if you see this clinically, but a lot of women who have normalized like yeast infections that they're not quite sure and actually have an infection and they're kind of like on the fence about like whether it's a problem because there's like a little burn or maybe a little itch, but not all the time. But like the discharge looks different or is more copious than you would want it to be, or what is normal from that respect. And so couple of takeaways from that from my respect, which is if you were experiencing anything that feels funky, bring it up to your care provider. Because if you can't talk about sex, if you can't talk about vaginal discharge, if you can't talk about your poop with your providers, you need to find a new provider. Like that, it's just there's no such thing as TMI. I saw this on TikTok and I think it's hilarious. TMI means tell me immediately, not too much information. And that's very much how we operate in clinic. But making sure that you're discussing those things because at the end of the day, we can swab and we can figure out what's going on. But if we do have a vaginal infection, we want to treat it because it does come with a certain degree of risk when it comes to pregnancy and preterm labor and things like that. And so we want to treat anything that is a problem, but also may not be. And so again, this just kind of comes into play with those lines being blurry, not kind of knowing what's up and what's down, but making sure that you're comfortable enough to see your care providers about that so that you can get assessed and then treated if that is an issue.
I think that's also true of like most things in pregnancy because I think there's a lot of like information that people are like, oh yeah, it's normal because it's pregnancy. Like, oh yeah, like that's just kind of things get dismissed a little bit. But there's a lot of things that we can do even as naturopathic doctors to help support patients through pregnancy that maybe wouldn't be options like to support for your medication. And obviously there's a lot of things that we are more limited in as far as like things that are more pregnancy safe and just the research as far as like the ethics around testing things in pregnant patients. Like we don't always have that research there to know that information for every single therapy. But like if you are struggling with things in your pregnancy and you are like trying to find relief on your own, oh my goodness, tell your healthcare providers or like come find a naturopathic doctor that sees patients in pregnancy because like there's some things that are very normal in pregnancy and it's good to chat about it, but then some things that you also don't have to struggle with.
100%. Any other symptoms that we haven't covered that you'd like to touch base on?
I feel like a big thing is like a lot of mental health in pregnancy. I think that's something that doesn't get talked about a lot, or if it does, like I feel like it's an important thing that we need to discuss as women, as people going through pregnancy, as like healthcare providers as well.
No, I think there's a lot of focus on postpartum anxiety and postpartum depression, which again, thank goodness, like that's an important conversation to be having. But there's also perinatal depression and anxiety and other mental health kind of disorders that kind of go along with that, even those associated with letdown when nursing, that some people will experience like intense depression symptoms with milk expression that short-lived but intense, right? And so making sure that one, I think when it comes to like postpartum planning, which is actually kind of what I want to pivot into a little bit at some point, is making sure that you have like a postpartum plan. I think a lot of people do a lot of birth planning, but not a ton of postpartum planning. And birth is going to be a day, a couple days, and not to say it's unimportant. That's 0%. We still need to prep for birth, but postpartum is like debatably forever, but it's at the very least for a year. Some will debate for multiple years. Again, I'll debate it's for life in terms of the changes that kind of happen to you in that period. But making sure that you know what the symptoms of postpartum depression and anxiety are, making sure that those around you know what they are, and that you guys have kind of discussed a plan as to what to do about those if they come up. And same, like again, in pregnancy, in terms of if any of that is feeling off or weird or just like not quite yourself, making sure that there's like zero shame in reaching out and getting support, getting assessed, getting medication if needed, because they can be life-saving and they can really make all of the difference in the postpartum experience as well, which again, pregnancy is 9 months and postpartum is forever. And so like having a better experience goes a long way. And again, just like a teeny tiny anecdote personally, like I said, mental health in my first pregnancy was much more of a challenge, but I felt awful. Like I was really sick. And for whatever reason, I had my hero cape on and thought that it better to do without medication, which I would like to go back in time and shake myself because I think I could have had a much better go at things. But this time around, like being able to take care of myself and feeling better has gone a really long way. And, have been fortunate to manage it with, Diclofenac, but making sure that, yeah, people are checking in and that we have plans as to kind of how to manage that. And also body image stuff. I see so much of that come up, especially there's a lot of people who struggled with body image issues or a disordered relationship with food. It doesn't need to be like a frank disordered eating diagnosis. And a lot of that can get kicked up in the pregnancy and postpartum experience. Sometimes it's better in pregnancy because we're like nourishing for someone else or we're moving our body for someone else. But making sure that we're cleaning up a lot of that dust so that on the other side and throughout that people are able to thrive and kind of enjoy the experience as best they can. It's also PS super okay if you don't enjoy pregnancy at all. That if you are just one of these people who are really struggling or you don't enjoy it or the body image stuff is like a problem, just know that two things can be true at the same time. That you can absolutely despise being pregnant and absolutely love your baby, and that neither negates the other, that both are incredibly valid and true, and that we don't need to caveat that. There may be spaces where that isn't appreciated, and that's okay, but that, like, just know that that's the truth. Any additionals to all of that? I'm like, I just ranted. Like, I can do that for days.
Yeah, I feel like just for a very personal note, I'm very open about it in my social media, but we had a pregnancy loss before having this baby. And so I think that is like a whole conversation on its own too, just about like the mental health that comes like after you've had a loss, or like for a lot of my patients when they've had really difficult journeys with fertility and then you finally conceive, like that, especially those first few weeks before you get an ultrasound or before you hit the 12-week mark, like there can be a lot of anxiety that comes up in that time. And I know for me personally, like, thank goodness for my own ND, like she just was so helpful and like fielding all of my anxieties of being like, is this fine? Is this normal? And I'm like, and I know all of this stuff because I see my own patients and support them. But part of like my goal in this pregnancy is to like shut my own doctor brain off for myself and just trust my healthcare providers to do that, because it was causing me so much anxiety in the previous pregnancy that I had. And then after having the loss, like I was like, I need to have a good care team that I can just trust that they're going to be on top of things and take care of me in that process, which is also why I'm such a huge advocate for people finding a really good therapist even before you conceive, like working on that pre-pregnancy, preconception. Oh my goodness, that's such a big game changer that you can just have with you through the pregnancy, with you through postpartum, that like you can have that continuation of care. Oh my goodness, it's so, so, so important. So yeah, that
Makes a
mental health
world of
piece.
difference. Yeah.
Yeah. There's so many things that come up in pregnancy that, like, for those of us that are very type A and we like to have things under control and we like to have things planned, yeah, all that goes out the window a little bit in pregnancy and you have to roll with the punches a little bit. So it's definitely like a very character building and character changing, but for you to have like some sources of stability and like practitioners that are going to help you through those changes, if that's really challenging for you, is so important.
Yeah, it's true. I tell people often that I'm like, pregnancy is the ultimate pregnancy, parenthood, motherhood, the whole kit and caboodle is really an experience in lack of control. There are perceived areas where we can control, and there are things that we can do. Like there's still places to be empowered and informed, and not negating that. But that ultimately, at the end of the day, what's going to happen is going to happen for better, for worse. And so I'm glad that you brought that up because it's even beyond the 12-week mark. I see a lot of people who kind of like hold their breath right to the end, right? And so, yeah, making sure that you have a care team ready to support you from that respect, because there's a lot that can be done naturopathically from a psychotherapy perspective and otherwise, and again, pharmaceutically if needed, because it can make or break the experience and it goes a really long way. So I'm glad that you found a team that like helps you feel confident and cared for. And Dr. Sarah talks about this all the time, but like you can't use your superpower on yourself. So I'm like, I outsource all of this stuff, even knowing it, but it's different. It's different to be the recipient versus the care provider, right? And so glad that you've leaned into that as well. It does make a difference. On that note, have you made any plans for how you're starting to prep for birth postpartum?
That is actually like on my to-do list for this weekend.
You're like, touch base soon. Well,
Yeah.
and Dr. Heather and I talked about this. I'm like, we might just hop on after we have the Chinese and talk a little bit about what was helpful, what wasn't helpful, what the experiences were, especially the like there's some interest in that, and give some of like a part 2 to this, if you will, the pregnancy part 1, the postpartum and labor part 2, and really go from there. But any other big takeaways that you want to leave people with today before we wrap up?
Yeah, I feel like every part of pregnancy can be it can be an enjoyable process. But if it's not, obviously get some help and get some support and be willing to talk about it. I think the more that moms are talking about their experiences, I think it helps a lot for you to feel a little bit less anxious, being like, oh, okay, other people are experiencing that. But if you're also talking about it in a sense and it's creating some more anxiety, obviously find that good balance about it. But yeah, have a good like support network of practitioners, of moms near you, like join mom groups around you, even like doing those prenatal yoga classes, things like that. They can all be really helpful for just helping your pregnancy experience to be more enjoyable.
Yeah, it goes a really long way. And fostering that in pregnancy so that postpartum, that same team exists, goes a really long way as well. I echo everything you said. So thank you so much for joining me today. And I'm glad, thank you for everyone who's listening for joining in. And like I said, hopefully we will have a part 2 coming in the summer of 2025, the fall, maybe, depending on how well. Yeah. We'll touch base. I'm like giving some space and grace for whatever comes. But enjoy the rest of your day and thanks for joining us.
Well,
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.